Hi, welcome back in. Now, we know as parents, it can be hard. Children, it's their fault, it's not ours, but no. Although as a kid, though, things sometimes can be overwhelming, and sometimes it's definitely necessary to get some families who may need to be helped. Lisa Richardson with Beyond Healthcare here with me this afternoon. Lisa, thank you so much for joining us.
Thanks for having me.
Mental health care, children, and especially, like I was saying a little bit earlier, it feels like those two, that feels wrong. It feels like they shouldn't connect. How does Beyond Healthcare like kind of make it, in a sense, okay? Because it's part of life.
Yeah. So mental health care is really important for everyone, not just adults. And we know that in our country especially, there are rising challenges related to children's mental health. And I think it's really important for us just to normalize that sometimes people are not okay. Sometimes adults are not okay, sometimes kids are not okay, and sometimes we need a little bit of help. And reducing the stigma around mental health, I think we've come a long way with that, but in particular related to kids, there's still challenges related to that. Just because someone needs help in their life is not something that should be seen as a bad thing, whether you're an adult or a kid.
What do I do? So my kiddo, I feel like maybe they're a little bit nervous, or maybe they get angry a lot more than what I've read in a book. I don't know. So are there signs, are there symptoms? When do I know that I'm overreacting versus, hey, this might actually be a problem?
I mean, children go through various developmental stages, right? And so emotions and feeling emotion can be normal in certain stages. But I think as a parent, we all have this internal knowing when something's wrong. And that's what we often hear when parents are referred to our programs at Beyond Healthcare, that they just know something isn't right with their kid. I think it's really important for parents to trust that, because you know your child best and you see them throughout the course of life. So if you have a 16-year-old and all of a sudden they're withdrawing from school, they're not hanging out with their friends, the activities they used to enjoy, they don't enjoy anymore, and you're seeing a marked change where you just know as a parent something is not right, that's probably a time to consult with a professional and to say, hey, you know, I think something might be going on. Or to even talk to your kid and say, is everything okay? And role modeling for them as well, that it's okay if something's not all right. Let's talk about it.
Is there a specific age where I can, because like you said, developmental milestones, you said 16. So 16, a teenager can definitely tell me, but like maybe, I don't know, 5, 6, 7, kind of preteen, preteen, teenager, if you will. Can they also have maybe signs or symptoms, or do I have to wait? Let's just wait, pull back.
Yeah, so everyone's gonna have a different, take on that. And, we serve 8 to 17-year-olds at Beyond Healthcare. And there are certain things related to, younger kids going through developmental changes and having, for instance, emotional control challenges. I mean, that's normal. Or you see tantrums in certain ages, that's normal. And so the big thing is just to look for changes in your child and then know that there's no harm in getting a consultation. So if you're worried and you think your child might be struggling with anxiety or depression and you're not quite sure, is this anxiety or depression, or is this just a normal 8-year-old going through the 8-year-old changes? Or then, call someone like us and say, hey, I would like a consultation because I'm not quite sure if this is normal for a child's development or not. There's no harm in asking.
And then my last question to you, because of course we're talking all about our own kids, because of course we always want to focus on your family. However, sometimes it's the fact of maybe I'm an aunt, maybe I'm the grandma, and I notice I'm seeing that I think is something off, but I don't want to offend my family member.
Yeah.
Is there an easy way to do that one, or this is just going to be hard regardless?
Depends on the family, right? But what we do know is that if children have 2 people outside of the home that care about them, they are much more likely to do well in life. So just being that support and that person that's always there saying, hey, if you ever want to chat, I'm here, and showing them that you consistently show up as auntie or whoever it might be, that is going to speak volumes to that child. And of course, you could always bring it up with the parent if you're concerned as well. But just being there is half the battle, and showing the child they have a support system outside the home.
It takes the village.
It does, true.
So if we wanted to get in touch with Beyond Healthcare, what is good call? Because like you said, a consultation couldn't hurt.
Couldn't hurt, yeah. So go to beyondhc.com or give us a call at 419-309-3991. Be happy to help you out with a consultation for your 8 to 17-year-old.
Lisa, thank you so much for taking
Thank
the time.
you.
Because again, it doesn't have to be a negative. It's not a bad thing. This is just about getting help, recognizing that there could be an issue, or we just want to make sure that everything's okay.
Absolutely.
Thank you.